Welcome to the channel Everyday Life, where we share useful, relatable, and easy-to-understand health knowledge so that we can all live healthier every day. In modern life, we often pay attention to obvious signs like pain, fever, cough, but sometimes forget that even the smallest changes on the body, especially in the ear area, can be early warning signals about internal health conditions. Have you ever noticed that the color of your ears suddenly changes? Or have your ears ever become flushed, swollen, or darkened without a clear reason? These seemingly harmless changes can sometimes hide serious problems related to the liver, kidneys, or cardiovascular system. Today, let's explore with Everyday Life the 4 abnormal signs in the ears that may warn of dangerous diseases such as hepatitis, kidney failure, or circulatory disorders. Follow along to learn how to recognize and take care of your body at the right time. 1. Pale, whitish ears. Warning of anemia or early-stage kidney failure. One of the first signs you should pay special attention to is when the ears become pale, lifeless, and lose their natural pink color. According to modern medicine, this condition may be directly related to anemia, low blood pressure, or poor blood circulation. When the body lacks blood, especially in cases of iron deficiency or kidney failure, the number of red blood cells and hemoglobin decreases, causing the skin, including the ear area, to become pale. Especially in chronic kidney disease, the kidneys function to produce erythropoietin, a hormone that stimulates bone marrow to create red blood cells, is impaired. This leads to chronic anemia, clearly shown by pale skin, pale ears, dizziness, and prolonged fatigue. Some people may also feel unusually cold ears, even slightly stiff to the touch, due to significantly reduced blood flow to the ears. If you notice your ears remain pale for a long time accompanied by fatigue, low blood pressure, and mild headaches, do not ignore it. This could be an early warning sign of kidney disease and requires medical examination for timely intervention. 2. Flushed, hot ears. Signs of infection or high blood pressure. In contrast to pale ears, ears that are unusually red, accompanied by a hot sensation and sometimes slight pain, are also signs you should not overlook. Red ears can appear for many reasons. Medically, this is due to dilation of blood vessels under the skin, a bodily reaction to temperature, infection, or sympathetic nervous system disorders. Specifically, if ears suddenly turn red without heat exposure, this may be a sign of high blood pressure, especially if accompanied by facial flushing, palpitations, and mild headaches. If ears are red, swollen, and slightly painful, it may be related to middle ear infection, outer ear infection, or throat infection, flu. Sometimes, this is also an early sign of allergic drug reactions, sepsis, or systemic acute inflammatory reactions. According to neurologists, some people with sympathetic nervous system disorders may experience periodic red ears without a clear cause. However, if this happens continuously with mild fever and fatigue, it is likely an inflammatory reaction due to infection that needs to be checked. Monitor additional symptoms to rule out cardiovascular, blood pressure, or upper respiratory infections. 3. Dark purple or blackened ears. Signs of circulatory disorders or chronic kidney disease. Have you ever seen your or a loved one's ears turn grayish, darkened, or bluish, especially the ear rim? This is a very concerning sign. Ear color changes toward bluish or black usually result from tissue oxygen deficiency, poor blood circulation, or accumulation of metabolic toxins in the body. In chronic diseases like kidney failure, liver weakness, or congestive heart failure, poor blood circulation causes the skin, especially areas far from the heart like ears, lips, and nose, to darken. A study published in Frontiers in Medicine states that chronic kidney disease patients may experience increased skin pigmentation, with ears becoming dark or bluish, accompanied by loss of appetite, itchy skin, and mild swelling. Additionally, people with heart failure, especially right-sided heart failure, often experience peripheral blood congestion, causing ears to appear bluish and dull. This is an important sign of poor circulation and oxygen deficiency, warning you to get your heart, liver, and kidney functions checked as soon as possible. 4. Pale yellow or swollen, painful ears. Warning of hepatitis, bile duct obstruction, or acute liver failure. A distinctive sign you should not ignore is ears turning pale yellow, especially the earlobes or ear rims. When the skin of the ears or the whole body turns yellow, it is usually due to increased bilirubin in the blood, a waste product produced by the liver to eliminate old red blood cells. When the liver is damaged, hepatitis, cirrhosis, or severe fatty liver, this function is impaired, causing bilirubin to accumulate in the blood, resulting in jaundice of the skin, eyes, and ears. Besides color, if you notice swollen, painful ears with mild swelling, accompanied by jaundice, fatigue, loss of appetite, and pale stools, these may be symptoms of bile duct obstruction or acute hepatitis. According to the Cleveland Clinic, jaundice is one of the earliest clinical signs of liver and gallbladder disease. Mild swelling of the ears with itching may also indicate serious liver problems like acute liver failure, requiring emergency medical care. When should you see a doctor? Ears are easy to observe but often overlooked during daily health checks. You should pay special attention if you have the following signs: prolonged abnormal ear color, such as pale white, bluish, darkened, or yellow; persistent ear swelling, pain, burning sensation, or itching; accompanied by systemic symptoms such as fatigue, loss of appetite, edema, jaundice, difficulty breathing, dizziness. These may be warning signs of liver, kidney, or cardiovascular problems. Regular medical checkups and blood tests for liver and kidney function are necessary for early detection and treatment. Ears are not only the gateway to experiencing the sounds of life, but also a mirror reflecting the health of internal organs. Even the smallest changes in color, sensation, or shape of the ears can carry valuable messages from the body. We hope today's video has helped you better understand the 4 abnormal ear changes that may signal hepatitis, kidney failure, or circulatory disorders. Listen to your body and observe every change carefully to take better care of yourself every day. Don't forget to like, share, and subscribe to the Everyday Life channel to not miss useful information about health and life. We will return with more relatable, easy to understand, and practical content in upcoming videos. Wishing you always good health and full of energy.